in the early part of the night, you went back to sleep, you're not going to remember that. It's the dream you wake up out of that you'll remember. So those are your 4 stages of sleep. Hi, I'm Dr. Stuart Menn. I'm a board-certified sleep medicine doctor. I came from a pulmonary background, and many years ago, by chance, a psychiatrist pulled me off the elevator at the hospital that I was at and said, we need your help. I have a patient who stopped breathing. And I said, well, what does that have to do with me? He says, well, this patient has sleep apnea. I had never heard of it before. This is back around 1977. And so the treatment of choice at this point is a tracheostomy, and I know you do that. And this was about 5 years before CPAP came around, and we could treat patients with that. And then about 2 years later, oral appliance therapy came around. So I've had a long association with the dentists. I never thought I'd be working with dentists before, but dentists helping them manage their patients so they detect sleep apnea often way before the primary care doctor does. I'm so happy about this conference. It's a great conference where dentists from all over who are interested in sleep and sleep medicine. So what I did today was give them a little bit of the history of sleep medicine, because a lot of people think that sleep medicine is all about obstructive sleep apnea, but sleep medicine has about 55 to 60 official diagnoses, everything from insomnia to restless leg syndrome to narcolepsy to periodic limb movements, and of course sleep apnea. So I'm trying to give them a little bit about the background, but I'm also a great believer in the relationship between the sleep doctor and the dentist. When you have that kind of partnership, you can manage patients much more effectively. For many years, we had some problems. The sleep doctors didn't trust the dentists, what they were doing. The dentists didn't trust the sleep doctors about referrals. But when we can form that relationship, that's so much better, and that's what we're trying to do today. So this kind of a conference is terrific because it allows the mixing of different specialties. I have to thank Dr. Eli very much for organizing this. We have a variety of practitioners that are here, and we're having a great conference here. Thank you so much.
So this is why this is so important to integrate into the medical establishment in some way, because we're the only people who actually do it on an ongoing basis, okay?
Hey, we're here at the Conference Center in San Diego doing a conference on sleep apnea. We had a great speaker this morning, Dr. Stuart Menn, who I've been friends with for many, many years. He was present when the field actually started and gave us a really firsthand review of the history, where it came from, who's involved, and what it's developed into. I then was able to talk a bit about the treatments that are available and kind of review with people at the conference what sleep apnea is and how the dental field fits into the model of care for this disorder. So it's really important. It's an exciting part of the field, and it's only just beginning to be, the surface is just being scratched by the dental community. So we're looking forward to doing a lot more of these, and if you want more information on any of it, contact us at the CEA or Danita at CEA.
Lucas Pitlick.
Hello, my name is Dr. Lucas Pitlick. We're here at the Sleep Conference in San Diego. I just spoke about the prosthetic or the restorative considerations for sleep apnea. We have a great turnout today. We had a lot of great questions, a lot of great presenters. We would love to have even more people involved into our future sleep events and our CEA courses. Looking forward to meeting all of you.
We take great pride in providing high quality care to our patients and not causing harm. And so when something like that happens, you're not rushing to go publish it. So it's difficult to find iatrogenic scenarios of malocclusion leading to unintended complications from wearing one of these devices.
Hi there, I am Dr. Steve Hutton, periodontist in La Jolla, and excited to be here at the Continuing Education Alliance Sleep Symposium, San Diego. and really enjoying meeting all the different dentists from the community and specialists that are leading the group in treating sleep apnea and the various modalities. Today I talked about the complications from creating the malocclusion, which can occur in using a mandibular advancement device, and specifically talking about the complications of creating the malocclusion from a mandibular advancement device, the dental and periodontal complications which occur in those cases. I also talked about doing micromobility assessment using quantitative percussion diagnostics using the interview device, which was just FDA approved last year, and we're currently in our practice one of the clinical trial sites for the experimental treatments in detecting tooth fracture and occlusal trauma.